Thank you for this opportunity to be presenting to you people connected to clinical technologies. My name is Dr. Maria Alejandra Pinero de Plaza, and I'm going to talk to you about PROLIFERATE. This is an evaluation framework and a tool that we are developing at Flinders University. I also work with the Center of Research and Excellence in Frailty and Healthy Aging. This is a very exciting project that I'm very keen to talk to you about it. Let me first share my presentation with you so that you get every detail. Okay, so as you can see here, this is PROLIFERATE, and we are going to talk about it from the perspective of an evaluation and usability, the evaluation, usability, and impact of artificial power technologies. So before starting this presentation, I want to acknowledge my co-authors. We are a big group of people from different sorts of backgrounds. We have clinicians, researchers, and merely academics, community members, patients, carers. So this is a big group that is working to understand how artificial intelligence can be evaluated and improved. So, and the other thing that is very important to do is to acknowledge that I am presenting and working from the traditional from the lands of the traditional owners. In my case, I'm presenting from Adelaide, so it's the Ghana people. So I'm presenting from their lands, and I live and work in these lands, and therefore I pay my respects to the elders, their past, present, and future generations and leadership. So a quick agenda. We're going to talk about the artificial intelligence tool that we will be evaluating. We are going to talk about why do we need to evaluate a tool of this nature at this point in time. We're also going to explore what it means proliferate in terms of a complete evaluation. We're going to talk about the frameworks that we integrated and kind of merged to produce this innovative approach to evaluation of artificial technology. And then we are going to talk about our research instrument, what are the components and how they work. And in the context of RapidXAI, what it means, the combination of these two things. And I'm happy to receive questions as well. So let's move forward. RapidXAI. Well, this artificial intelligence tool that we're going to talk about a little bit was created because of a big problem here in Australia. So nearly 1 million people visit Australian hospital emergency departments because of chest pain or similar heart attack symptoms like. So our doctors need to be very precise and acute in the diagnosis of this situation. So currently, the emergency department assessment of these patients is a very resource intensive and often inefficient, which contributes to hospital congestions and might cause harm to some patients. So in order to respond to this kind of thing, a big group they created artificial intelligence algorithm, a machine learning algorithm basically, to improve the emergency care of people with chest pain. And this RapidXAI, they call it, is basically a clinical trial that is going to be running across several hospitals in South Australia, in which they aim to test whether the use of the computer algorithm in hospital emergency departments can help doctors provide better care for patients who have symptoms of of heart attack or chest pain and understand what is going on. So this is the big, all these people that you see here and me smooth there. We are working in a partnership grant. This is an NHMRC, the National Health and Medical Research Council of Australia, actually provided funds to this partnership project. So this team is dedicated to test the effectiveness of RapidX AI from a clinical point of view. What we are talking here today is that we are going to evaluate not the clinical outcomes of that, but the integration of this from a patient perspective within workflow. Not only patients, end users perspective. So we talk about clinicians and about every person that is involved or affected in the workflow of the emergency department and the diagnosis of chest pain. Okay, so why do we need, in a research project of this nature that has been approved, they already have funding, why do we need to evaluate this aspect that is not necessarily connected to clinical outcomes, but affects clinical environments and patients and the whole process? So we all know, everyone that is connected to health research, we all know that this is a very difficult road, that we as researchers, clinicians, practitioners in this field, we need to demonstrate the importance and impact of the things that we are doing, because we are receiving, well, when we are funding for this kind of big projects. So what else do we need to do? We need to demonstrate the health consumers, the community is involved. We need to demonstrate that we have a design that is human-centered for people. We need to work with end users, all these people, feedback. We need to work in partnership so that we involve citizens in research, our taxpayers. We need to provide evidence and measurements to understand, but not only understand, but track the effects longitudinally. So we need a systematic way to identify what is going on, how this can be changed, and how this can affect in the future. And this quantification has been shown to be very tricky to do for this kind of projects where we are talking about the perceptions, understanding of artificial intelligence, and big complex groups working together. Why do we need that? Because we want to create sustainable responses to these systemic and complex health care and social problems that we are facing today. So there is a demand for optimization and quantification and understanding of this kind of problems. So what is the effect of using an artificial intelligence tool that will help doctor in this, cardiac doctors in these emergency department circumstances? What does the patient feel? What does the technician feel, etc.? So in that sense, we developed this concept, or let's say this framework and tool called PROLIFERATE, which is an adaptable framework and tool, as I said, to evaluate different processes, outputs, and products of participatory research. So we conceptualized PROLIFERATE as an all-inclusive evaluation. What do we mean by that? You can see here in this figure all sorts of evaluations and the evaluation questions that can be done. So at the beginning of any evaluation, when the program begins, we need to understand the needs. To what extent this is meeting my needs? What can be done to address the needs associated, let's say, if we're talking to about artificial intelligence, to this artificial intelligence tool. Then when we have this new program that is going to be implemented, so is the program operating as planned? What are the process? Are the process of the implementation working well? So that's the question. And these two part of evaluation, they are known as formative evaluation because we kind of work in a qualitative way to understand what is going on and how we can solve the situation. Then when we have established program, we have another type of questions. The program is the program achieving what we plan to do? The outcomes are we meeting our what we decided to our KPIs? And then we have the other aspect, the mature program. So is this working as we predicted? It was going to work? What is the impact of this? So we see needs assessment, process evaluation, outcome, and impact evaluation. Normally, these are different types of evaluation: formative, more qualitative; summative, more quantifiable. What we want to do with Proliferate is to merge all the things and make it qualitative but quantifiable evaluation so that we can predict and model what's going on. So we understand the usability and impact of RapidX AI within emergency departments. How did we do that? So we did an integration of different models and frameworks in order to create this new amalgamation that we are talking about. So we're going to talk about the KT-CNM, the KT Complexity Network Model. We're going to talk about the LEAP Learning, Evaluation, and Planning Framework. We're going to talk about expert knowledge elicitation, which is a Bayesian technique that we put together to this other, with these other approaches so that we can create this new type of evaluation. Okay, so the KT-CNM, KT stands for Knowledge Translation and CNM Complexity Network Model. We as a team, the co-authors of this work, we work with these principles. They define the nature and approach that we take to evaluate. So, knowledge translation, complexity network model. What means knowledge translation within this context? Knowledge translation is something that happens through a network, a combination of people and factors, processes and sectors. When this combination, the effective combination of these processes and sectors create the appropriate timely creation and movement of knowledge to those who need it in order to improve what they do. Okay, it sounds complex. Let's see, it's basic. We have in research normally certain processes. We identify a problem, we create knowledge about the problem, we synthesize the latest evidence, then we implement it and we evaluate it. And that's kind of a linear vision, of knowledge translation and the research process and how we go from an idea to impact. Unfortunately, in real life, things are more like the graphic that we are seeing. We have different stages that not necessarily happen in a linear way, and we have different people that are involved and affected in this process. So here in the figure, we can see the community, health, researchers, the government, policymakers, quality and compliance people. If we're talking of a hospital, education, you say, well, what connection has education with putting artificial intelligence in an emergency department? Well, people, clinicians, nurses, in general, they have to learn about using this tool. Administrative people have to learn how they are going to process this information, what are the steps, how the workflow is going to change, and researchers, people like us. So in that sense, what we are seeing here is that in order to implement something like RapidX AI, this activation process, this knowledge translation process, depend upon the agents promoting change successfully across and between the multiple processes and sectors of this network. So we see a multi-level network because we have a level of the processes and a level of the people, and then we have other layers or levels of this network, how they connect, how they communicate, how they treat each other, what they believe about their work, etc., etc. Very complex. So we then import other principles, the principles from the learning, evaluation, and planning framework. Why? These principles are very inclusive, democratic, participatory, that's the concept. And this is necessary because we want to understand the complexities of the network that we talk about. And if we're going to evaluate the implementation of technology, we have to evaluate all these different angles and perspectives and things that are occurring within the implementation process. So what do? We follow this LEAP framework, which is very logical. We explore the outcomes that we want to achieve. So what are the needs? We together, this transdisciplinary group, when I say transdisciplinary, I mean people from different disciplines, different backgrounds, working together to produce something that goes beyond discipline-specific knowledge, something that goes further to impact the complexity of the network. So this group has to establish what are the outcome indicators, how we will know we are doing what we want to do. Then we together found the resources to create this process, establish our methods, which is basically what I'm talking about here today, and how to do it, and then to establish our outcome indicators very clear so we know that we are achieving what we did, and then to keep going this optimization cycle. So these are principles. I call it here modus operandi, because every member of the team has to understand that they have voice and they can vote in terms of this process and how it has to be adapted. So that's very important if we want to understand the complexities of implementing something that we are hoping to maintain and sustain across time, and they will benefit everyone that is involved in the process. Okay, so in general here, just a few lines about the 5 steps. So the steps support partnership approach to achieving change and improvement, support this common planning and acting according to established needs. We are clear about what we hope to achieve and whether we have achieved it. At outcome focus. We recognize that achieving change depends on building people's strengths and ability, planning together. So we seek to build capacity and develop assets. Plan, act, evaluate in partnership, involving, like I said, community, patients, consumers, technicians, administrative people, educators. And then we are committed to learning from what we do. So this process teaches all of us how to be better in terms of this evaluation and implementation of artificial intelligence. So applying this learning to improve efficiency and effectiveness. And then we go to the quantification component and the innovation, because most evaluations will always have these other components that I'm talking about: partnership, looking to understand our goals and objectives together. But what is innovative now is that we don't stay there. We don't sit on this. We can apply this to big numbers. We can create a process, big data, following same principles, but taking a data processing approach. And what is beautiful is that we have this kind of tool, this evaluation tool that is called the expert knowledge elicitation process, which we converted and adapted to our Proliferate evaluation. So what is the expert knowledge elicitation process? We have here an illustration of the process. We have a person, this is the big person, and we have a dark area. We have in the figure you can see a letter and a person, a small person taking things out of the head. These things are converted into numbers, and then those numbers are organized in a distribution. So what does this mean? So the left person has a knowledge-based experience in connection to artificial intelligence, in connection to the tool. Some ideas about what is it that influence the person's belief about this and the person's perception about using technology. So we have to identify that. And that's what's the little person there in the letter, which is basically our Proliferate. Our Proliferate tool is a digitalized way to extract this knowledge from the person, convert it into numbers so that we can create a distribution of this prior knowledge. The unbiased theorem, they call it prior because it's the first knowledge that we gain about this belief. So like I was explaining, the dark area of the head refers to the latent cognitive factors that affect theta. We call it theta, this information, this belief itself in the elicitation process, where Proliferate takes these ideas and convert them into quantifiable numbers. So this Proliferate elicits information. Proliferate is a facilitator that has the task of reaching this cognitive belief of the person and transform them into a distribution. So as belief, we were talking about, they were mostly qualitative. That's the beauty of Proliferate. It converts through a questionnaire that we have designed, convert this belief into numbers that we can then use to create a prior distribution about the person's belief. And we do this for each person in our complexity network, and we understand then the characteristics of each type of, let's say, audiences that we have in connection to the evaluation of artificial intelligence. So the evaluation have adaptable items, constructs, and questions that help us to, let's say, segment our different end users according to sociodemographics, according to the responses to these constructs. They are understanding, comprehension, emotional resonance concerning artificial intelligence. Do I enjoy it? Do I like it? The barriers that they perceive. If there is an inconvenience, a noise in the process of utilizing it, and the likelihood of changing their current behavior to actually use the tool, the artificial intelligence tool. And we have open questions. So these are the key factors of our evaluation. And in general, we can summarize the process through the three steps. So the evaluation approach includes the prior distribution that I was talking with the expert knowledge elicitation process. Then that knowledge is updated with new information specifically connected to the demographic variables and the constructs and the open questions. With this, we calculate the posterior probability or the conditional probability that is assigned after relevant evidence or background about the artificial intelligence tool is getting, so that we can create prior, posterior distribution, and then we can create a Bayesian inference. So the prior distribution, a posterior distribution, a likelihood function where we predict the likelihood of the impact of this tool, and we kind of model how effective will be Proliferate to each specific end user or each specific network and level that we are working with and exploring. So what is the benefit for the RapidX AI people? Why is important that they do an evaluation of this type? Well, with our work together, we can ensure the artificial intelligence, this artificial intelligence-based decision support platform, RapidX AI, is fit for purpose for working within acute care environments, so that all the end users are happy with it. Under that same conditions, we actually work and engage with each relevant stakeholder statewide to ensure that the clinical delivery process, the clinical care delivery process is actually re-engineered and improved as we are testing RapidX AI across the clinical trial. So again, every stakeholder is embedded in each stage of the project, and that ensures a strong uptake, and also inform these people of the clinical trial, of the changes, the modifications, the improvement opportunities, how and what's the best avenue that they can use to actually target specific issues if we find them. So we will obtain expert information about the social, institutional, relational, and many other aspects and mechanisms that are required to understand in order to optimize the utilization and scalability of these artificial intelligence-based decision support tool, so that it can operate effectively within the health systems and according to the consumer-centric practices. So this was an explanation of how we now can evaluate all sorts of artificial intelligence tools and many other processes and research projects, outputs, outcomes, and we can model that, we can standardize the evaluation, we can predict with 95% confidence interval and credible intervals what is going to happen. And we as KT people, I mean knowledge translation people, we can create a strategy so decision makers, people, let's say in this case, who are implementing RapidX AI, have the tools and the pathways to optimize and guarantee the sustainability of their technology. So if you have any question, please reach out. These are my contact details, and with this code, you can also get information about my publications and my co-authors. It has been a pleasure, and thank you for inviting me.